Sudden shoulder pain without injury, causes and treatment. Sudden shoulder pain can occur with an injury, but it can also appear for other reasons, including arthritis, bursitis, and pneumonia. Sudden shoulder pain without an injury can result from an underlying issue that the person may not previously have noticed. The condition may have progressed slowly up to the point when a person first feels pain. Here learn some possible causes of sudden shoulder pain without an injury. Osteoarthritis. Osteoarthritis is sometimes called wear and tear or bone-on-bone arthritis. It develops over time as the cartilage of the shoulder joint wears away. The bones start to rub together, causing friction and pain. Osteoarthritis can also stem from an injury such as shoulder dislocation or fracture. There may be no symptoms in the early stages, but pain can appear as osteoarthritis progresses. It may become harder to move the shoulder. There may also be a crackling sound or feeling known as crepitus or popping joints. Osteoarthritis can affect either or both joints in the shoulder, the acromyoclavicular or AC joint and the glenohumeral joint. AC joint pain. Osteoarthritis in the shoulder most commonly leads to AC joint pain. This is the joint between the clavicle or shoulder bone and part of the shoulder blade known as the acromion. AC joint pain mainly affects the top of the shoulder but may radiate to the side of the neck. Glenohumeral joint pain. The glenohumeral joint is where the arm bone or humerus joins the shoulder blade or scapula. Glenohumeral joint pain is a symptom of osteoarthritis. It will mainly affect the side or back of the shoulder and may feel as if it is deep in the joint. It may worsen with weather changes. Rheumatoid arthritis. Rheumatoid arthritis is an inflammatory condition that causes joint swelling and pain. It is an autoimmune disease and occurs when the immune system attacks healthy tissue. Rheumatoid arthritis in the shoulder can cause pain throughout the shoulder and will likely affect both shoulders. There may also be skin discoloration, warmth, and swelling. Rotator cuff tendonitis. The rotator cuff is a group of muscles and tendons that hold the shoulder joint in place. Rotator cuff tendonitis refers to inflammation of these tendons, possibly due to damage or irritation. It can result from an injury but may also stem from repetitive shoulder movements. Genetic factors and older age may also contribute. Tendonitis can cause pain and swelling throughout the shoulder and difficulty moving the arm. Pain may be worse at night. Symptoms tend to worsen over time. It can lead to torn or damaged tendon. Rotator cuff bursitis. Rotator cuff or subacromial bursitis is an inflammatory condition that causes localized pain toward the front and side of the shoulder. The skin may also feel warm. The pain does not tend to radiate. Bursitis results from inflammation and swelling of the bursa, a sac of fluid that helps cushion the joint. Rotator cuff bursitis often affects people who do repetitive overhead actions such as painting ceilings. Rotator cuff tears. A rotator cuff tear can result from an injury, but tendon damage and pain can also result from long-term inflammation. The muscles and tendons that link the bones to the shoulder joint may become fully or partially torn or detached. A partly torn or damaged tendon may be unable to hold the humerus properly in place. This can lead to friction between the humerus and the shoulder joint or glenoid socket. Damage can affect the bones, leading to pain. Lack of blood supply to the humerus. Some conditions can lead to a reduced blood supply to the shoulder bone or avascular necrosis or AVN. Bone cells cannot thrive without a regular blood supply. In time, this can cause the shoulder bones and joints to collapse, leading to severe pain. Factors that increase the risk of avascular necrosis include steroid use, sickle cell disease, and a history of traumatic shoulder injury. Sometimes, however, there is no clear cause. Calcific tendonitis. Calcific tendonitis is a common cause of shoulder pain. It happens when deposits of calcium phosphate crystals build up in the rotator cuff tendons. Up to 20% of people have no symptoms. However, it can lead to pain, reduced motion, stiffness, tendon damage over time. Doctors do not know exactly why calcific tendonitis occurs, but there may be links with diabetes and gout. A pinched nerve in the shoulder or spine. Pinched or compressed nerves in other parts of the body, such as the shoulder, neck, and upper back, can also cause shoulder pain. A pinched nerve in the shoulder may lead to pain, weakness in the shoulder and arm, numbness and tingling in the hands. Cervical radiculopathy refers to a compressed or irritated nerve in the upper back known as the cervical spine. The nerve can become pinched as it branches out from the spine. It can cause similar symptoms to a pinched nerve in the shoulder. Cervical radiculopathy can result from an injury but can also happen as people get older due to the disc of the spine becoming dried out and compressed. Thoracic outlet syndrome. Thoracic outlet syndrome involves compression or pinching of the nerves and blood vessels in the shoulder, arm, and neck. Neurogenic thoracic outlet syndrome can result in a dull, aching pain in the shoulder, neck, and armpit. The area just above the collarbone may be tender. Possible causes include tumors that press on a nerve, poor posture, changes in bone formation, repetitive arm movements. It is more common in females and may appear in pregnancy. Adhesive capsulitis or frozen shoulder. Commonly known as a frozen shoulder, adhesive capsulitis is an inflammatory condition that leads to shoulder pain, shoulder stiffness, reduced range of motion. It can result from an injury, but often there is no clear cause. Risk factors may include diabetes, thyroid problems, the use of certain medications, cervical spondylosis or arthritis of the neck. Experts do not know exactly why it happens, but it may occur when inflammation in the shoulder leads to fibrosis and adhesions in the joint. The inflammation causes the pain, while the adhesions and fibrosis make the shoulder harder to move. Heart problems. This type of pain is known as referred pain, as it affects the shoulder but does not relate directly to it. Shoulder pain can also result indirectly from cardiac problems such as a heart attack, reduced blood flow to the heart, pericarditis or inflammation around the heart. Digestive problems. Referred pain can also affect the shoulder due to gallstones, pancreatitis, gas after abdominal surgery. Other causes. Other underlying causes of shoulder pain can include pneumonia, Paget's disease of the bone, herpes zoster or shingles. Treatment. The treatment for shoulder pain will depend on the cause. Options include changes in behavior or use of the shoulder, physical therapy, the use of non-steroidal anti-inflammatory drugs such as ibuprofen, corticosteroid injections in some cases, applying heat or cold therapy for both alternately, medications to address an underlying condition, shoulder surgery in some cases. When to contact a doctor? Anyone with new, severe, persistent or worsening shoulder pain may seek medical advice. In some cases, early intervention can help prevent shoulder pain and complications from becoming worse. If other symptoms are present, a person may need urgent medical attention. Shoulder pain accompanied by chest pain and breathing difficulty, for instance, can be a sign of a heart attack.